Over my career, I've seen way too many people who have suffered trauma as a result of the work that they've done in the emergency services sector. Unfortunately, some of those people have taken their own lives, and many of them who haven't have gone on to suffer significant problems throughout their careers, and many of them well into retirement, and that's just a terrible, terrible shame. My experience isn't unique. There'll be many of you out there that know exactly what I'm talking about, and many community members who know people that work in our emergency services who've suffered the same problems. It's important though that we don't just think about treating people who have actually already suffered an injury. We've actually got to start thinking more about the preventative side and actually trying to stop people getting into a situation where they're so badly affected in the first place. And that's why I'm so passionate about the work that the Emergency Services Foundation is doing with agencies to help prevent the impacts of mental health injury on our workforce. At the end of September, I'll be taking a walk that's almost 1,500 kilometres that's going to focus on trying to raise awareness of the situation that I'm talking about, but also to raise funds for a couple of very important and innovative programs. The first of these is a pilot of a residential wellbeing program where we're going to provide the opportunity for people to come together after they've been through very significant events where they might just be starting to get a little bit wobbly in themselves, to meet with others, those with clinical experience, those with experience of the events that they've been through themselves, to be able to talk through what it is that they've seen, what they've experienced, how they're feeling, and to be able to find ways to actually progress in themselves to a place where hopefully they actually don't develop into a far more significant mental health injury for themselves. And the second program is a lived experience program where we're going to bring together people who actually can use their lived experiences to be filmed in a safe way to help people who are actually maybe at the start of their mental health journey, and as I said, if you like, just starting to get that little bit wobbly, where they will be able to talk to others, they'll be able to understand how to better seek help for themselves, and they'll also be able to understand that there is actually hope at the end of this. This is not a journey where there is always a bad outcome. There are good things to come, and therefore that's what the lived experience program will actually provide for them. We're certain that both of these initiatives will have a significant impact and a significant benefit to the 125,000 paid and volunteer staff that we have working in the emergency services sector. Too often they come away from their work deeply affected by what they've seen and what they do, and we need to get on top of that.
What an inspiration Tony is. I'm tired already thinking about 1,500 kilometres. But we so need to bring these initiatives to life to support those who support us, and their families and loved ones who invariably share the impact of the harm felt by emergency workers. These aren't things a single agency can effectively do on their own. It makes absolute sense to collaborate and take a sector-wide approach for these important initiatives. A lived experience program and a residential wellbeing pilot. Nobody else is doing these things. ESF is a small organisation doing big things. Please consider donating to our fundraiser as we start this incredible journey, one step at a time, to make a real difference to the mental health outcomes for those people who are always ready to keep Victorians safe. With your support and ESF's focus on prevention and a sound evidence base for all we do, we know what a huge difference we can make to Victoria's emergency workers and their mental health outcomes.
So the work that Tony's doing with Tony's Trek is absolutely critical for agencies like Ambulance Victoria, State Emergency Service, FRV and all of the others. Because at the end of the day, it's our members, our staff, that are impacted on by mental health and wellbeing, by the things they see and do every day, and by the workplace factors, particularly during the pandemic over the last couple of years. So what Tony's doing is so important for us, because at the end of the day, we are better together. We do work as one. And this is about making sure we work as one in the important issue of mental health and wellbeing for our emergency services workers.
The awareness that Tony's Trek's going to create and the donations that are raised out of his adventure are going to allow the foundation to put programs in place that we don't currently have now.
Tony's Trek has brought the whole sector together. This means we're focusing together on mental health and wellbeing. It means that we're focusing together with the community on the issues that face emergency service workers and volunteers. So it's important that we get behind Tony's Trek, not only to raise money, but to make sure we all focus on the issues of mental health and wellbeing.
We are currently working to reduce the stigma of mental health injury for our members in our everyday operations, and a program like this will raise awareness and funds to address this problem.
So, I'll do the legwork, but what I'd really love is if you could actually get on board and help us, either by becoming a sponsor for the event itself, or by making a donation, or even actually providing information about the event to others so as they can donate to our fundraiser to improve the mental health outcomes for our emergency service workers into the future. Because after all, we are better together.